Good?
Yeah.
All right, so when we look at the wrist, ulnar styloid process is that one that pops out right there. Okay, you can actually see it sometimes when you turn your wrist the right way. Radial styloid process is right there for the radial, right? For the radius right there.
Bumps.
Then we move over slightly, and you feel that right there underneath my thumb? That's the Lister's tubercle. So we go radial styloid, Lister's tubercle, ulnar styloid right there, okay? Then we move into the proximal row and the distal row, okay, of carpal bones. So this will start with the proximal row right here, navicular, okay? So navicular, lunate, triquetrum, and pisiform.
How do you
Okay.
say the T one?
Triquetrum.
Triquetrum. I can't
And then we turn it over this way and we go to trapezoid. Right there. Or trapezium, trapezoid, capitate, and hamate. You can actually feel, we call it the hook of the hamate, and that's right there. So if you look at here, navicular, lunate, triquetrum, pisiform. Navicular, lunate, triquetrum, pisiform. Go this way, and now instead of up here, you're coming here, right? And you go trapezium, trapezoid, capitate, hamate.
Okay.
So they follow in order. First four are proximal, second four are distal. And they always go thumb to pinky.
Okay.
Okay? All right. Metacarpals right here. These are your metacarpals. The head of the metacarpals are right here. That's kind of your knuckles right there. MCP joint ligaments, you would go on either side right there. Okay? So you can't really get in there to feel them, but they're on either side. That's the best place to feel them right there. Thenar eminence, that is the muscular tissue that's on the thumb side. Hypothenar eminence, that muscular tissue that is on the pinky side right there. Proximal phalanges, intermediate phalanges, distal phalange, okay? You're gonna go with the thumb interphalangeal joint right there. Proximal interphalangeal joint, distal interphalangeal joint. Got it? So this is the bone, right? Then when I'm saying phalanges, and then the joint is there.
And we only have
Okay.
to do that for one finger, right?
Correct.
Okay.
But here, the
The
thumb
other
only
thumb.
has one. So you want to make sure you do one. But here you have a proximal and a distal.
Okay.
So a PIP and a DIP.
Okay.
Proximal interphalangeal, distal interphalangeal. Anatomical snuff box. So one way you can do that is have them pull their thumb up. And you can feel that right there. Okay. So there's two tendons. The snuff box is in between the two tendons, right? So this is when we feel that. This is the extensor pollicis longus, because think of the thumb extending backwards. This one is the abductor pollicis longus because that one comes straight out. Okay, so extension is this way, abduction is this way. Extensor pollicis longus, abductor pollicis longus on this side. Kind of do this and do that. Look at that, stick right out there. That's your palmaris longus tendon.
Oh, dang.
Okay, so that's the one that sticks out the most. We have carpi radial or ulnar carpi ulnaris here, and then radialis is on that side, but you don't need to know those. Okay. Ulnar collateral ligament is going to be right here, where the ulna meets the carpal bones, and radial collateral, radius to carpal bones, that's right there. Okay. PIP collateral ligaments do on the side. DIP collateral ligaments do here. So if you're doing the joint, you could go up and down. Ligaments, make sure you're going side to side.
Okay.
I would take both for the joint, but not for the ligament. If you're doing the ligaments this way, that won't work for me. You got to do it on the side for the ligaments. Okay. Flexor muscles are here, and extensor muscles are here. Okay.